There's two ways of looking at ICD-10. First, from a compliant perspective of getting all the requirements in by October 1st, 2014, I would call that enablement. And then there's a way to look at it strategically. So think about your relationships with your third-party payers. How are you getting paid today? Many organizations are going towards value-based purchasing, bundled payments, accountable care organizations, all impacted by further clinical differentiation within documentation. So a great opportunity there for an organization to be strategic. Think about your strategic relationships with your physicians. If you could think about 10 years ago, about 60% of physicians were freestanding, not employed by hospitals. If you look at today, that's about 40%. So great opportunities for further alignment with the physician community. Another thing that really ICD-10 was intended for, clinical research purposes. So if you're getting much more granular and specific around the diagnosis and treatment of care delivery, think about the power of that information being available for research purposes, for future cares. So a lot of different aspects of business opportunities besides just what you traditionally think of with technology and coding. What hospitals should be doing as they deal with ICD-10 from a planning perspective is first starting with governance. Any big, large-scale initiative requires strong governance within an organization. As such, this is not just an IT initiative, it's not just a coding initiative, it really is a system-wide enterprise transformation initiative. So strong governance really needs to be established. So think about representations from Chief Operating Officer, your Chief Medical Officer, your Chief Information Officer, and the like. So it's a broad group of constituents to be successful from a governance perspective. Secondly, program management. This is a multi-year undertaking when you think about the transformation and readiness with the October 1st, 2014 compliance date. So as such, you need to think that way, dedicate the appropriate resources. Think about a transformation life cycle, going from assessment to basically design, to implement, and ultimately operate. So most organizations are dealing with the assessment phase right now and actually blending towards the design phase. In the design phase, you're really looking at developing a comprehensive work plan to make sure all the appropriate steps are configured for October 1st, 2014 and beyond in regards to planning. It's very important to establish work groups around what are the expected remediation activities. If you look at ICD-10 from a revenue cycle perspective, looking at how you schedule the patient, deliver care to the patient, manage the reimbursement and finances and billing for that patient, all of those aspects are really remediation work groups that we're describing. So you think about it from a best practice perspective, establishing work groups for IT vendor management, establishing work groups for coding and clinical documentation improvement, looking at contract management, how you interact with your third-party payers. That in and of itself is a work group. So one of the things that I want to make sure that everyone's aware of is there needs to be work groups established, but actively engaged, okay? Not working in a silo, but actively engaged in a coordinated manner through strong PMO capabilities. The greater the effort and detail around a project plan is really the critical aspects of success. The organizations that are failing in regards to their ICD-10 preparedness is because they're not putting together the appropriate amount of effort in detailed project plans. So they haven't considered the interdependencies of key items for ICD-10, such as a major system conversion may be occurring over the next 2 or 3 years that hasn't been considered as part of the planning exercise, as an example.